Welcome to the Health Tech Headlines Podcast. Today, we are talking about an important topic, a serious topic, and that's mental health. And I'm thrilled to be joined by Dr. Lorenzo, a licensed psychologist and associate professor in the Department of Psychological and Brain Sciences at Indiana University. And also joining me today is Travis Somerville. He's the director of product development, and he's an artificial intelligence and machine learning expert at Syra Health. It's a pleasure to have both of you on the Health Tech Headlines podcast today.
Thanks for having me.
So first, let me start with Dr. Lorenzo. We're talking today about a serious topic, and that is mental health. I'm wondering, in your area of expertise, what are some of the trends and talk about mental health that you're hearing today, just to get us started?
Well, I think one of the maybe obvious things is that it's a big problem, right? I think depression and anxiety before the pandemic were really big problems. And then certainly the pandemic accelerated a lot of that in the sense of stress, people losing their lives, people losing their jobs, symptoms secondary to illness. And so I think the big thing that everybody recognizes is that it's a really big problem. And I think the second thing that we recognize is that the old models of treating mental health problems by giving people prescription antidepressants, by doing one-on-one psychotherapy, while they're very good, it's very difficult for those models to address the mental health needs of everybody that needs treatment. So I'm not saying that people shouldn't get therapy or shouldn't get antidepressants, but we also need to have more things that can reach larger numbers of people. So you're seeing a lot of interest in technology like the Syra product that we have talked about to address the needs of people, especially a lot of people that have maybe milder to moderate symptoms, so they can manage the symptoms before they get a lot worse, although really the apps and technologies help a lot of people.
Wonderful. So I'm glad you're talking about our technology. Syrenity is the product name, and you've done a wonderful job of explaining a unique gap that technology fills in the area of mental health. So can you tell me a little bit about how you got involved with Syrenity's development and what types of insights have you been sharing with the team as development has progressed?
Yeah, so the team reached out to me because of my expertise in this area, really. I have a training as a traditional therapist, and so like I still have a patient. I see one or two patients a week. So I have expertise in that. I did my dissertation at the University of Pennsylvania, where a lot of the modern psychological interventions, namely forms of cognitive behavioral therapy, were developed. So cognitive behavioral therapy is a way of doing therapy or psychotherapy or talk therapy, and it's very much grounded in science. And so CBT, cognitive behavioral therapy, was developed at UPenn, and variants of it were developed in UPenn. So I have this kind of very traditional training in therapy and therapy research, in addition to expertise with the technology space and studying technology-based interventions. And in particular, a big concern in my lab is really making sure that the technology that we're putting out there has been studied and is following principles of science. And it's really going along with the best practices that we know from research, help people get better in terms of their depression and anxiety. So really a lot of my contributions to the team have to do with those topics.
We're thrilled that Syrenity is an evidence-based or science-backed app with your expertise being included. Let me bring in Travis Somerville to the conversation. And Travis, maybe as a technology expert, you could comment on how unique is it to have science integrated within an app focused on mental health?
Well, at first, I think it's an exciting challenge that we got the expertise from Dr. Lorenzo, and he gave us certain heuristics on the outcomes that he needs to have a diary entry or a journal entry produce. And so it's very exciting to try to translate your heuristics, Dr. Lorenzo, into a chat app. So I find it really exciting that the thing that we have going on in like the AI journal is really driven by what you've taught us. And we've stayed very close to your methodology in terms of the questions you want answered and things like that. And I'm really not seeing that in any other apps right now.
So let me ask you both, when someone maybe is battling depression or anxiety, substance use, anger, insomnia, those mental health conditions that Syrenity is addressing, how important is it to look for an evidence-based, in other words, scientifically backed app, do you think?
And here's that question too. There ends up, I think.
Yeah, I can take that.
Yeah, go ahead.
Just because I maybe already brought it up. Yeah, I think it's very important. So, like Syra Health, a lot of companies recognize the need to fill the space, right, in an unmet need for mental health treatment, right? And so this marketplace has grown really rapidly in the past, I don't know, 5 years, even the past 10 years. And so there are a lot of apps available. Most of these apps, unfortunately, have never been tested in clinical studies. We're doing a clinical study on Syrenity right now with promising results so far. And even when they're not studied, a lot of the principles that they have are not necessarily the ones that we think that have been found to be most effective. I'm going to give you an example. The Syrenity app, like most other apps, has exercises that help you with, for example, meditate and engage in mindfulness practice, which can help reduce depression and anxiety, put you in the moment, and increases your quality of life. But most of the time that mindfulness-based meditation is studied, it's also studied with behavioral change strategies, things that you do in your life differently to help with your depression and anxiety. Most apps actually lack a behavioral change component, like exposure to the things that people are afraid of or engaging in behaviors that are rewarding to decrease depression. And so I think that's a really good example where we saw a need that was not consistent with the science, right? Where the marketplace was not consistent with the science, but the Syrenity app is introducing some of those CBT strategies that have been found effective.
I love it. It's such an important topic and it's such a delicate topic. It has to be treated objectively as you're describing. It has to be accurate and the information has to be validated. So let me bring Travis back in. You've got an interesting and challenging role in bringing the science that Dr. Lorenzo brings to the table, pulling it actually into the app. So can you give listeners an idea of what is that like? I just think this is such a unique pairing of a licensed psychologist with a product development leader. How does it all work, Travis?
Well, one side effect of trying to get all the science in is, when you first start the app, it asks a lot of questions. If I can figure out how to maybe tone that down, I will. But all those questions, when we go back to Dr. Lorenzo, he needs those to apply the science. So ultimately, you maybe ask some extra questions, including like your social hobbies and things. And so I don't know if this is what you mean, Dr. Lorenzo, but, somewhere in the app, I'm going to talk about goals and social things that I should be getting out and doing. And there's also a section called Face Your Fears, and so there's a lot of sections that it turns into what I initially described in my intake and all the details of myself. It's able to, apply those on the other side, what did you call them? Behavioral, what was it?
Strategies. Cognitive behavioral strategies, yeah.
Yeah. And so I think a lot of that ties into the behavioral strategy that the app is allowed to help you with.
So what you're saying is users who are engaging with Syrenity, there's a reason behind the questions, take the time to fill them out. They result in the best outcomes and the best potential interventions from user experience. So, Dr. Lorenzo, You mentioned there's a research study underway. Can you talk a little bit about that and how unique is that when it comes to a mental and behavioral health app like Syrenity?
Yeah, I don't want to. I'm gonna butcher this in terms of the specifics, but a very high number of the mental health apps that are in the marketplace actually just don't have any study that validates them. I'm not talking about like 40 or 50%. I mean, most of them like 90% or something like that. So that's a gap that in industry, there's this lack of connection to science. On the other hand, we have a research study that was published this year in the journal Behavior Therapy, where we found that when academics like myself developed digital technologies that they have found effective in studies, 84% of the time they don't make it available to the public or in the App Store or Google Play. Right. So there is this kind of disconnect between the world of industry on the one hand and academia in making the things that we know work available to the public. And so it is actually quite rare to have it. It's getting a little better, right? I think it's trending where people are recognizing the importance of studying these technologies. But unfortunately, a lot of the stuff that's out there for people is not supported by science. And so right now we have this study. It's ongoing, where we're recruiting people from all over the U.S. And when people sign up for the study, they get randomized to get immediate access to the Syrenity app, or they do 6 weeks where they are waiting, and then they get access to the Syrenity app after the 6 weeks, where we're trying to see, like, is it true that the people that are given the immediate access to Syrenity, does their depression and anxiety change faster than the people who have to wait a little bit?
You mentioned at the start of the podcast that you're seeing some encouraging results. Can we talk about those a little bit?
Yeah. So, people I mean, very bluntly, right, especially when it comes to depression, people randomized to the app are seeing faster reductions in their depression. I do think it's important to keep in mind, these apps are not a panacea, right? It's not like you open the app once and then your depression goes away, right? It's not like that. But on average, we're recruiting adults that have elevated high levels of depression, that they probably would be diagnosed with depression if they saw a psychologist, and they're seeing faster drop off in the studies. In the study, kind of like similar to what we see in other treatment studies, that the app is a little bit better.
Wonderful. And you mentioned there are certain people that the traditional treatment doesn't work for, that an app may make more sense for. So can you walk through what maybe the right or the most appropriate user to have a positive experience with Syrenity might be like?
Yeah, so a lot of times when people ask me this question, what they think is, oh, if somebody's depression is really severe, they probably shouldn't use the app. And that actually turns out not to be so important, right? At least when it has been studied, it seems like people can benefit from these technologies regardless of how severe their depression is. What in other research studies, so our research study right now, we've recruited 135 people, so roughly half of them have been given immediate access to the app, half of them the control condition. We're expecting to recruit around 350, combining a pilot and the full study that we're doing. So it's still something that's underway. But in other studies, generally, I think people benefit from these apps, but there is a big problem where people stop using them, right? Where for whatever the reason, the app isn't engaging enough, or sometimes people feel like they already got the lessons, and so they don't really reuse the app. And maybe sometimes they do well, but sometimes also they forget, because we're humans, and it's hard to pick up a skill like therapy is a skill, right? Kind of like going to the gym. You don't just do it once and then you're fit. You have to work on it a little bit. So it tends to be, for example, men tend to like participating and using these studies a little bit more than women or people that are non-binary or genderqueer. Younger people, interestingly enough, they're quick to pick up these technologies, but they also drop them. So actually, the older people in our studies tend to be a little bit more engaged, and they tend to stay to the study. They tend to follow the instructions a little bit better. The technology involves learning strategies and then applying them in your life, right? So I think people that are good at teaching themselves stuff, like maybe they were good at school, maybe they really like reading, those people tend to do a little bit better as well.
Fascinating stuff. So I'm learning so much. I'm learning, like we talked about, that the questions are worth it. Do the assessments, hang in there, practice the new behaviors. The outcomes will improve by hanging with it. And for Travis, it sounds like there's a considerable challenge in making folks want to come back and pick the app up, making it as engaging as possible so the depression and the anxiety can stay away from the user. What do you think, Travis?
Yeah, that's really the trick. We want to make it as fun as possible, and we're going to keep iterating it on it. And I can't wait to get your feedback, Dr. Lorenzo, as you see it evolve over the year.
And I think one thing that we like to stress that may be helpful for the people listening to the podcast and helpful certainly for the research participants is that, because we have this integration of industry partnership and academia, we're learning and we're improving, right? It's not like we're right now at the ultimate version of the app. We have so many ideas for what's to come, like different clinical problems, exercises that are more engaging. And so when people stay using the app, even when they're not getting better yet, even when they're not seeing as much benefit as they would like, we learn from that, right? And we actually need that information to say, for example, are younger people less engaged, right? Is there some kind of material that they like better than other? And so by participating in the study, people are helping us a lot. They're doing a service to us. And so it doesn't feel good. It doesn't feel good, of course. And we've discussed Syrenity, but there are other resources I know that Syra Health works on related to mental health. But it really does help us improve the app.
One interesting thing that we haven't released in your app that we do have in your data, and I'd really like the app to be used more and gather more data before we release the feature I'm about to speak of. But predicting someone's mood, just like you might want a forecast for the weekend before you go on a camping trip. I think that's going to be a very powerful science-backed feature of us, if you do engage with the app, us being able to predict ahead of time, maybe you're going to have kind of a really good week next week or kind of a depressive storm. And so we don't really know where to go with that. We'll have to be under your guidance, right? You'll have to let me know that if I could predict from the data that someone's about to have a more cyclical depression or something like that, it would help them to know that. So we'll solve that along the way. But there's some really interesting things we can do once we get going with this.
Yeah, I have a lot of ideas. I'm happy to talk about it, and it is a very important topic.
So a podcast in the future for sure. So let's just talk for a couple of minutes about some of the additional features of Syrenity that make it unique. We've talked about the fact that it's part of a research study. We've talked about the fact that it's scientifically based, and we get to talk to one of those scientists right here. Let's talk about the AI-backed diary. Travis, could you speak a little bit about how unique that is and how it works?
Yeah, and I think it might be interesting, Dr. Lorenzo, if you talk about like the 4 questions that are actionable that you gave us when you have a therapy session. I could say them, but I think it's more interesting when you say them, and then I'll kind of describe what did we do to make that happen.
Yeah. So there is a little bit of research that suggests that when people are able to interact with humans or to some extent with chatbots or artificial intelligence agents, they're more likely to use these digital technologies, and the digital technologies may be a little bit better. So then the question becomes like, what should the digital technology do? And what we've worked on right now is helping a person understand the problems that they are having in very concrete ways, right? And so, for example, sometimes people will say, I'm depressed, right? And for me, I'm depressed could mean I'm just watching TV, but I'm not really tuning it. I'm not paying attention. For some other people, I'm depressed. Maybe they're doing work to avoid going back home because they don't want to be depressed at home. So the people may use the same language, but what it actually is very different for different people. And you may treat it differently depending on what the problem is. And so the way we've designed the app is to make it so that it pulls information from the person about what specific problem they are having, how often they're having the problem, how bad it is, and how much it's interfering with their life in terms of how much does it bother them? Does it interfere with their ability to work, with their ability to socialize with friends, with their ability to be with their family? And so that has two interesting things. So I already said one, which is that it helps you clarify like specifically what's going on. In the future, right, if the app intersects with mental health providers, right, if a mental health provider is using it, they could have that kind of information to know from the person in their own words, but very concretely what's going on.
Yeah. And I think there's a fourth question, which was like the cherry on top that we always ask at the end, which you taught us, which is, do they want help with it? That was a big aha moment. And so the way we implemented Dr. Lorenzo's heuristic is we break the ice with the person and we kind of find out what's going on. And then we very pointedly, we use generative AI. So whatever you're talking about, it'll try to naturally ask you how severe it is. So it's not like it just says, how severe is this? 1 to 10. It tries to work that into the conversation in a natural way and throw some empathy your way. Because you know what? Hey, empathy from AI, it's free. It does a great job. It does a great job saying, I'm so sorry you're feeling this way. Does a better job than I do, really. But we take them along this very structured path. We make it as interesting as we can, the way it asks that. But ultimately, Dr. Lorenzo, we ask those questions that you want us to ask, and then we're able to create a therapist summary. And that therapist summary is easy to create because in that AI diary interaction, we follow Dr. Lorenzo's heuristic of finding out those things that bring out more information that are ultimately actionable if you were to share it with a therapist. Right now on the app, those therapist summaries are just sitting there for you. You can export them as a PDF and ship them off to your therapist. Maybe one day we just have a telehealth option and you check the box and send that over to my therapist. But right now, so that's kind of how we implemented your heuristics that you taught us, Dr. Lorenzo.
And I think the important thing is that even though they are heuristics, right? So it's general ideas, general principles that we're asking people. The inclusion of the generative AI or the large language model makes it so that from the person's end, it's more personalized, right? And so I think that's a very important thing that people look for is you want to use mental health material that is tailored to you, right? Like you want to feel that there's some degree at which it's responsive to the thing that's happening to you and not just the same 5 or 10 questions that you're answering, no matter what your problem is.
Yeah. And so one issue we had with, okay, we're not just going to go with specific questions repeated again and again. We're going to generate it, right? Kind of playing with fire there for a moment, right? What if I said I'm drinking too much and then the AI says, well, gave me prescriptive advice. And so that's a no-no, right? So we have a guardrail in our product that's going to catch and filter if the AI generates and veers off course. We literally have things that can stop that from happening and cause it to just not give you that advice, to not to call you an alcoholic, not to call you fat, not to call you, and tell you what AA group to go join. So it doesn't do that. It just basically listens, follows down, and gets that information from you in a safe way. So it's honestly quite conservative the way we have it right now, and I would like to make it a little more fluid and fun in the future. But right now, it's very solid on the rails, with how it talks to you. So I hope your research group doesn't find it too boring to talk to the AI journal, because we really keep it on the rails. And, I worry that it's not fun enough. But I don't know if it's science backed to have to be fun. I'm just not sure.
Yeah, I'm happy. I'm happy to talk about that. I don't know if it's a. I think this is one of the things that people thought, oh, if these things were just really funny, people could come back to it, and then it turns out it's more like maybe that is a feature for some people, but in general, that funness. I don't think a lot of people are, when they're looking for mental health help, they're necessarily needing it to be the funnest thing. I think people gravitate to doing the thing that works. I think if the thing that works happens to be fun, then of course people would like that better. But it becomes really hard to beat something when it's giving you really, really good advice if you just make the good advice slightly funnier, right? But it could be also different for different people.
This conversational AI diary sounds an awful lot like an empathetic therapist in the pocket. I really have enjoyed hearing about it. As we start to wrap up, are there any other features beyond so many that we've already discussed that either of you feel like make Syrenity unique that's worth mentioning?
I think from my end, I'll just highlight it again just because I get really excited. The science, because I think it really permeates it cuts across everything that we try to do with the app, and it cuts across my work. And I feel like the team at Syrenity Health really understood that. And the reason I like working with them is because they really honor that. So like one example that I'll give is that when people are using the app, there's the ability to customize it, but it does ask you how you are feeling using clinically validated screening scales that measure depression, anxiety, a little bit of anger, substance use. And that's really important, right? Because sometimes people think they're getting better, but the clinical scales don't say that. Or, sometimes people don't think they're getting better, but when they look at their scores have actually come down a lot, and maybe they're just having a bad day in that moment. And that kind of outcome monitoring is really good, has been found to improve outcomes in therapy, and is a thing that is not intuitive to anybody, right? I think like if you tell me like, did you have a good week? I'll probably say yes, but I'm thinking that I'm going to go to the pool after this or something like that, right? And so we need to do that. Tracking is very, very helpful with conditions like depression or anxiety that can jump up and down. And sometimes it's hard to know what the past week has been like. And so I just think the fact that the science is so embedded in it, it is really important to me.
I'll just say I just really enjoy the fact that we've implemented this in a way that I think is safe for people to use. So I think it's a tall order these days to make sure that we're getting guidance from scientists and approaches, and we're keeping safety and ethics in mind. So I'm pleased with the outcome so far.
Well, it sounds like both of you are doing an amazing job in each of your areas of expertise. And I'm just delighted to have had both of you here today on the Health Tech Headlines podcast. It's been thrilling for me. Dr. Lorenzo, thank you to you. Wishing you all the best. And Travis, thank you as always for your expertise. I hope you'll both join us again as we talk about more features for Syrenity coming up in the not too distant future.
Thanks for having me. Likewise, Christine and Dr. Lorenzo, pleasure working with you both.
Thank you.